Sandy, can you hear me?
I can hear you.
You can hear. Okay. Okay.
Yep, I can hear you too.
Yeah. And so I know everybody else, but could you introduce yourself?
I'm Sandy and I work at a day program in Minnesota, and I work with adults with disabilities, and it's strictly just on work.
Oh, okay. And in which part of Minnesota?
Van Ness Heights, close to the Twin Cities.
Oh, okay. All right. Very cool.
Yeah, I've been there for 20 years, so it's going great.
Oh, very nice. Okay.
It's nice to hear
Yeah.
everybody's stories and how things
Yeah.
are going.
Yeah. And it's so, of course, we have more of the international coming up in the evening. That's some of the more Eastern countries, but it's always fascinating. When Jan was presenting on the European Union,
Yep,
I was thinking how more centralized it seems, in a way, even though, they are not United States of Europe. They're in the
right.
European Union, they're separate countries. But I think, Jan, the way you presented and you and Zuzana presented, it was like it was the European Commission who is doing the recommendations, who is doing the guidelines. And in the US, it's the guidelines. I mean, they're not even, I mean, there are some guidelines at the state level, but I feel like a lot of providers have a lot of independence, flexibility. Anyway, I was just thinking it was a little more centralized.
Yep.
I think this is the case for the European Union. However, the other question would be to which extent the member states they follow the guidelines, prepared by the Commission.
Mm.
It largely depends on the kind of a political mood of the particular country and the member state.
Hmm.
Some countries they become a little bit more sort of um, not that much keen on the European Union, so they
Mm.
sort of
Hmm.
tend to do their own uh, policies. But since the European Union funds loads of projects in the disability field, so the member states they also do have some kind of an ideas what's going on the European level, because once they use the funding, they implement the European funding, they should follow the kind of the European guidelines, not necessarily regulations, because the members the European Commission does not have legal power to force the member states to do things except discrimination. The European Commission's got a power, but it's more or less it. Yeah. And also, we in the United States, you've got disability law across the states. We
Hmm.
don't have that.
Are you referring to ADA?
Yeah.
Okay. So there is no equivalent to ADA in the European Union.
Not into the kind of details. We have the convention, Disability
Oh,
Rights
right, right.
Convention,
Yeah.
but it's very broad. It's not like the law here. And then the Disability or Discrimination Directive, which I mentioned in the morning, that's another document. But otherwise, there is uh, nothing else.
That's very interesting. I'll come back to that, but I'm interested, Sandy, from your perspective of working in the field for 20 years. And what did you say your role was in the service provider?
I just started a new position working on customized employment.
And what is your job title?
I'm a career exploration counselor,
Ah, career exploration counselor. Okay, all
and it
right.
just started in December, so we're still kind of figuring it out.
Okay, okay. And so what was your previous job title?
I was a job coach out in the community supporting clients working.
Hmm. So over the 20 years, in the field that you mentioned, what are some of the things that you have seen change and what has stayed the same?
Um, the way our clients get supported and how families are more involved in their lives over the years.
Mm-hmm,
And
mm-hmm.
just and there's lots of things have changed with like VRS, and I'm not even sure about all that stuff because it's
Yeah,
kind of confusing. But yeah, just involvement.
involvement.
And
Okay.
even just
Okay.
like people out in the community when we go out to find jobs, they're around adults with disabilities more than they ever have been before. So it's,
Mm-hmm,
oh yeah, come on in. We've worked with you guys in the past, so they're more open.
mm-hmm, mm-hmm.
Yeah.
Interesting. Yeah. And Karen, I mean, you have been in the field for a while too, right?
I joined the field in 2017, and
2017. Okay.
so about, what does that make it? 10 years now, not
Okay.
quite, 8 years.
Mm-hmm,
My
mm-hmm.
background's actually healthcare, so I
Oh,
have
okay,
a
that's right. Mm-hmm,
yep.
mm-hmm,
So I came from the healthcare field. I spent about a decade in psychiatric nursing. There's a lot of
mm,
overlap between behavioral health and the things that we're seeing. And as you know, dual diagnosis anymore is a really big. We see more and more mental health all the time.
mm-hmm,
So it's a big deal. But there's even in the, I would say, 8 years I've been in the field. Um, I think the focus on employment has been a really strong change even in that 8 years. And I think it's really positive. I
mm-hmm.
just can't say enough about how work impacts a person's life. And I loved your title for this session, Dignity of Work, because that really is so important to the people we work with all the time. So
Mm-hmm.
it strengthens their role in the community, their role with their family, their self-esteem. It's just a really, really positive thing. I'm not telling you anything you don't
Yeah.
know.
Well, actually, I'm glad it's sort of the title has been around. We have had it around now for a while. So for me, it's kind of like it's always there. So I don't think
Right.
about it. But one thing I'm going to say is that at one of the conferences last year, at IACID actually, in Chicago, we were launching the book that we wrote based on the previous Dignity of Work Forum. And one of the participants in the session challenged us. She challenged the title. And she said, I know where you're coming from, but in her work, in employment services, she said she experiences a lot of indignity of work. And she was talking about examples of, underemployment, lack of supports, lack of opportunity. And so since that session, I have been really thinking about the dignity of work and the indignity of work and how we have both, I think even
Totally,
now.
I agree.
Mhm.
And I think the sessions this morning kind of highlighted that underachievement. And I
Mhm.
would argue that we channel people with disabilities into the entry level positions of food service and environmental services, retail. And they're not out there running cash registers. They're in the back room stocking shelves. I
Mhm.
would argue that's a failure of employment providers and community, and the fact that we haven't insisted that people with disabilities have better opportunities. Not that they can't start there, it just shouldn't end there. And oftentimes you see we just rotate them from one cleaning job to another cleaning job, or one dishwashing job, or table wiping, or when they're just so capable. And that's what I think the program that we're trying to do really is about, is how can we really empower this person to recognize that they can do this, which oftentimes involves us getting the residential providers more involved and more on board with what it is they're able to achieve, families and guardians more involved, because it's really comfortable for all of us to put them into a building or put them in a day services program, take them to the library. So that's kind of the message of our presentation, is we as providers really have to change. And we're really talking about a systems change. This isn't just the person wanting something different and aspiring to a different job. This is, once they get a job, how do we help them grow in their skills to advance to the next level? And that's where I think the field is headed now after a long pause. But we basically have been comfortable with programs that were built for people coming out of institutions. And I'm old enough and was in psychiatric nursing when to still have spent time in institutions and watch people transition into the community. The programs were needed back then, but we just got stuck there. So, okay, I'm off my soapbox.
No, yeah. Well, Sandy, go, because otherwise I'm just going to take over.
Okay.
Well, and at Merrick, there's a couple of us just started doing the customized employment. And I feel that when I was in the community with my clients, that I was kind of doing that, where we did work in a grocery store and they were just stocking shelves. And now they are, one of them wanted to be more in fashion. So she helps out in the gift department, and then there's other of them that want to bag groceries and bring it out, and which leads up to more and more things and getting them out in the community doing other things. So I feel like I've been doing customized employment, even though I wasn't doing it for so long. So it's good to see them get where they want to go.
Yeah. The point you're making, Karen, about we are still at a place where we were, where people are leaving institutions. I think that's part of our conversations at our institute all the time, with not just employment services, but residential services too. And I agree. I don't think we have moved on yet. Even the terminology that we use, we use the term waivers from institutional service, you know what I mean? Like stuff like that it's the community-based service is not the norm.
Right. I'm glad you brought up terminology, though, because I think the fact that we label people vulnerable adults and we tell them over and over again that safety, security is what is so important to them, and that they need to be with somebody. I mean, it just starts early and it goes all the way through. And when we repeatedly say to someone, "Oh, you're a vulnerable adult," and you hear it in the conversation all the time, and you hear them call themselves vulnerable adult, it's really difficult to help them transition into feeling confident and safe in the community. And it takes a lot of work to move beyond that self-perception of I'm vulnerable, I need to be taken care of, tell me what to do. And when we have a strong-spirited person, we can oftentimes figure out ways to squelch that. So.
Yeah, that is true. I'm just gonna see if Kazufumi and Amy, if you would like to join the conversation. We are talking about various things related to customized employment and issues related to the fact that we have not moved very far over the years, and making some comparisons between countries and continents. So if you want to join the conversation, feel free. Something else I wanted to say. The issue of the right to employment or the right to work. So, I think in the US, like with healthcare, for example, we don't often talk about the right to good healthcare. or the right to employment, except maybe with employment first policies. But I believe, like Jan, in the case of Europe with the CRPD, you actually do talk about the right to employment, right?
I think it's good point. There are two things. It does not necessarily mean it's a right to have to be employed. It's kind of a misunderstanding of the particular article of the UNCRPD. The right is to have equal access, equal opportunities to get employment, not to be discriminated. And the European Union goes a little bit further and talks about the reasonable accommodation, and which is a duty of the employers to make reasonable accommodation. Of course, the question then comes, what is reasonable? So but the European law does specify the reasonable accommodation, not in terms of the amount of money, but talks about the burden. So when the burden is sort of too high, then it's not regarded as a reasonable accommodation. So that's the discrimination is not, there is a fight against discrimination. Nobody can be discriminated, and secondly, the reasonable accommodation is regarded as a duty of the employers. Yeah. And
duty or response. I mean, if they don't, what happens if they don't provide reasonable accommodations?
If they don't provide reasonable accommodation, it can go to court.
Okay.
And or it can be dealt by the employment inspectorate, or what maybe there's an equivalent in the United States or Minnesota, I don't know. But it's an authority which is responsible for legislation and in employment. So it can be, and the companies the case was proved, they can pay some kind of a penalty, or it's a kind of discrimination. It's not a direct or indirect discrimination in European legal terms, but it's again it's illegal basically. But my sort of comment also would be that the public awareness about the European law, even the domestic law, when it comes to discrimination, disability, is rather low. So people are not that much aware of, for example, the reasonable accommodation. So they don't question it. Sometimes they might be discriminated themselves in terms of the reasonable accommodation not being provided, but because they don't know, they might just, yeah.
Good morning, Dr. Chikrenji. How are you? Early it is are you in Tokyo?
Good morning.
Good morning. What time is it? What time is it in Japan?
It's 8.
Oh, okay.
24.
Okay, not too bad. That sounds really good. Yeah. Well, I think, in I think there have been a lot of good changes in the States for employment. I think our employment levels of people with disabilities are probably the highest, one of the highest, I would say, in the world. But there's still discrimination for sure on many levels. I really enjoyed Nicole Edwards' presentation, the one about her collaboration with Land of Lakes. And I know she has worked really hard for a couple of years to establish that relationship and to get people into that company. It's not an easy task. Also, at the University of Minnesota, especially at our institute, we employ quite a number of people with disabilities. And you would think that institute that specializes in disability would do this well, but we have challenges. We have quite a bit of challenges to do that. Right, Nick?
We do. I was going to say something, and then my dog was trying to play with his toy. It was very
Okay.
noisy, but I wanted to talk about transition because regarding folks that we have employed, and there was something that a guardian, a mother who said about their daughter, like, my daughter, her entire life has been serviced by other people, and now she is coming here as in employment to provide services for other people, and there's a disconnect there. It's very difficult for that employee to understand, I have to provide something for someone else. I'm not getting that for me. And that's what transition is supposed to reveal here in the US. But when I was in the Czech Republic, I may have if I misunderstand this, Jan and Renata can explain, but they don't have the schools that we have here. It's not part of the school system. It's direct from that age into employment, and then they discover what they may want to do, whether it's in services, janitorial, or farming, or into retail. And it was interesting because I do have challenges with employees at our institute who are, I don't want to do that today. Well, that's not really an option. Like that's you're skilled to do it. You can do it. And my reply to that always is, there's always tasks in our job that we don't want to do, but we have to do it to move forward. And so then there's that bit of hurdle that I have to go through, because going back to the mother's comment, they've been serviced their entire life. They've received services their entire life, and for the first time, they're trying to understand that they have to give something back.
That's a really good point. Yeah, I don't often think about that.
I would just say, Nick, we see that all the time. And we closed our in-building sheltered workshop 14C in 2020 during the pandemic, and just said it's not the future, so let's change now. But what we found is that that the word choice is so misused and so overused in the field that people think that everything is a choice every single day. So if they didn't want to go to work in their enclave when they were in the building, we said, okay, because it's your choice, and they didn't, and someone took their place. So we had to help people unlearn a lot of really bad habits that we facilitated, and we had to teach a lot about your choice is employment. So employment has a responsibility, and it is a really, I agree with the mom, it's a really big shift for people. And we see that with students coming out of the school system as well, is that they really are treated as individuals who need to be taken care of. And as students, I would argue that some of our young people in non-disability programs are coming out with the same kind of, well, I'm not ready to do this yet, therefore I don't have to. And I think we need to do a better job of really supporting people to identify their role in society. And probably the biggest strength we see is when people are actually volunteering. We have a garden program. They raise produce and then they give it to a food shelf that supports the homeless. And they're the ones that are growing the food, managing the decisions, taking it in and donating it. And it's a very different mindset for them. And it's very positive in terms of how they view themselves in the community differently when we do that. But I do think we have to stop using the word choice. Not everything is a choice, not for me, not for anybody. So when is choice an important part of what it is they do? And if you remember my last slide was, if the only colors you ever know are white, gray, and black, when you ask what color you want, you're going to say white, gray, or black. And we really view it as our responsibility to introduce them to a mosaic of opportunities and experiences so they actually do have choice.
Yeah, no, that's such an important point. And I know, so Jan does a lot of work with life course trajectories, and I'm just curious if you have seen in the life course trajectories this theme of misuse of choice. Or misunderstanding of choice, or
yes, but maybe I'll change the subject a little bit to I think Nick mentioned also the responsibilities. I think that for many years the discussion has been about rights, but far less about duties. I think that the transition programs need to focus also on how to build this kind of feeling for responsibility and duties, not only about choices and rights. It's also how to guide people to take the responsibility over. Although in our project where we have been following the young people with intellectual disabilities, the theme which emerged was their responsibility, and they very often talked about the outcome of the transition should be being responsible. But on the other hand, sometimes in our field, I meet service providers, and they argue that it's becoming difficult sometimes to work with young adults with disabilities. That they argue, this is my right is this or that, and I've got the right to choose, but it's not related to the also responsibilities and duties. So and I think it's partially because, for example, the UNCRPD has not been much discussed critically. Like what we do in academia, we have it has been taken as granted, and I think that's something what should be done. Yeah.
Hi, this is Amy. I just want to kind of step in and talk a little bit about Merrick too, because we're kind of going through the same thing. We still hold the 14C license, but I think with a lot of stuff going on, we don't know how much longer that will be. Sandy Olson, actually, too, that is on here. We all work together, and we just started our customized employment course, which is opening up a whole new thing for us, which is pretty cool. But what I'm dealing with right now, so we work with the guys that work, independently out in the community. with their raises they're getting, now everybody wants to cut their hours back because they can't, they'll lose Social Security, and like we fill out the subsidies and we do all these things, but we don't know if it's gone through. So now, if they've gotten so far and they've done so well, now they're going to have to backtrack because Social Security or Medicare, all that wants to take more of their money. So it's been a struggle.
Yeah, I'm glad you spoke up. I have been to Merrick. Usually I go to Merrick when we have international visitors.
Oh, yeah.
My connection to Merrick is Greg Bartz, who is part of the Rotary Club in White Bear Lake, and
Oh,
he's
yeah.
the connection there.
Yeah, I've heard that name. There's so many people that come through, but
Yeah. Yeah, Karen, do you want to speak to the issue of
Sure.
the balancing the payments and all?
Amy, you raise a really good point. We see that sometimes as well. What we do with most individuals is run them through the benefits analysis. You may do that as well, but really in the end, when it gets done, they can see that working doesn't actually almost always ends up in them having more money and more revenue than they did before with just Social Security. I think that's a road we have to travel personally, primarily because parents and guardians are so afraid that they're going to lose benefits, and then there they'll be if they lose their job, et cetera, et cetera. So I think it's just part of the journey to help people become more comfortable with being employees. And I really like what Jan said about responsibilities and duties, because for so long as a 14C, if we went to the zoo, everything was paid for them. All of their transportation was paid for, et cetera, et cetera. And they're making really, really solid salaries. Sometimes they're making more than our career and life coach that's with them. And yet they don't really see that as a need then to pay their own taxi cab or to pay a fee to go do something. And so I think we have a whole reset in the industry to help people recognize duties, responsibilities, obligations. What does it really mean to be a citizen of the community versus somebody who's stuck in a dependent role or a segregated work environment or a segregated day service environment. But what you're seeing, Amy, I think is just a journey to help them see where they actually will benefit from keeping their hours of work, while at the same time recognizing that for some people that's just what they're going to do, and you just move on. I think one of the things we see more than anything with especially some of the people that came out of the sheltered workshop, as well as many of the young people coming out of the transition programs, is that they are so deconditioned that working more than a few hours a day is way too much for them. And 5 days a week at 4 hours is too much for them. And I think we're going to have to step back and help people get some stamina because they just really are exploring community and careers program or that we were talking about is really started with transition students, and we partnered with the school system, and we ran it 5 days a week, 6 hours a day, and they were exhausted every single day and totally wiped out by the end of the week. And we weren't running marathons. We were just in the community for that period of time with employers and taking public transportation. So we just have some work to do in the field, I think.
Yeah, and a lot of the guys that they're worried about Social Security are the ones with the older parents, and they're the rep payees, and so now they're all in a panic. So I have 2 meetings tomorrow with families that are just in an uproar. It's like, well, you should be happy, we should be happy that they're making a buttload of money and doing things that they love to do and paying their way. I mean, it's okay if they have to let go of a little bit of it, so. And then like like everybody's saying, the younger guys that are coming in, right now with VRS, I mean, that's kind of like not a good topic either right now, but a lot of these guys just want to work, 2 hours a week, or they have to sit down and they can't, do this and they can't do that. So trying to find employment, for them, and then the parents are involved and trying to get them to step back a little bit and just be like, you got to let them choose has been a battle as well.
Yeah, we have a couple success stories that we will connect with parents that have been successful. And at the longer you're at this, you'll find that we have one person that's completely off of services. He's off the waiver. He's in his own apartment. He is employed full time. He has a girlfriend. It's a beautiful, beautiful, beautiful story, but it did not happen overnight. It was a journey even pre-pandemic, through the pandemic, and then when we really strengthened our model to help people become more independent, he just flourished under it, and his parents are thrilled, and he's thrilled. And so as you get some notches in your belt in terms of the successes, it does get a little bit more contagious. We have other people looking at how can we help accomplish that, or take people as far as they want to and can go.
Yeah, we're excited to see where this is going to go. We just have to relook at everything these days with VRS, and we'll just we'll do it. We got Sandy on our crew now, so she's awesome with all the guys. So, and it takes special people sometimes to let them flower into new things.
And along with what Jan said, to allow them to experience the consequences when they decide to do something, and not rescue them from maybe a mishap or a failure that doesn't provide them personal harm, or and that's been really hard for my team, because again, the whole goal is keep people safe, warm, comfortable, et cetera, or has been the goal.
Right. Yeah, I mean, when anybody else messes up, there's consequences, and it's okay to have those. It's lessons.
On that, I want to say something on that note that you just said, Karen, about Jan. We had an employee that had a hardship with some of the supports that we were providing. I'm going to be transparent with that. But what happened with that hardship is that they taught us how we can support others better because of it. That was very difficult for them. They were not happy with me. They were not happy with us, but we learned a lot through that. We learned how to create a more accessible environment. We learned how to create more accessible work conditions and employment opportunities moving forward. And unfortunately, they felt really poorly for some time. But at the end of the day, they were actually providing us a better service for more people coming through our organization. And they now have been acknowledged for that support that they gave us. So we always, a lot of times we're saying we're supporting them, we're supporting them, we're supporting people with disabilities. Well, the person with the disability is actually supporting us in the long run.
Yeah, they're great teachers.
Yeah, and Nick, you're right? Yeah, and that in the Czech Republic there are no transition programs per se, like they're in the US.
Yeah, we have schools, as you know, but they are like more training programs for 2-3 years. It might be sort of to some extent similar to what you call your transition program. But
So like a vocational sort of a program.
yeah.
Mhm.
Yeah. But I understand when we have had this kind of discussion several times. the transition should not be a building. To my understanding, the transition support, transition program, transition sort of support should go beyond the an institution, or I mean in terms of like a school, or it's the support should be multidisciplinary, not focus only on an employment as an outcome. Yeah. Much broader.
Well, and we try to tell like the parents and like the staff, why don't you guys take these guys out and teach them how to bag groceries and teach them how to, do some of that, stuff so they're prepared because they're like, oh yeah, I want to bag groceries. Well, they've never bagged a grocery in their life and now they want to, so there's like life skills that they can do that doesn't have to revolve around just, employment services. I mean, family, friends, getting them out to do different things, volunteering.
Yeah.
My other job at ICI is directing an art program, and that's a completely different type of occupation or career, is creating aesthetics that are purchased by someone to display in their home. And that's usually something that's not going to be on a job board. I'm looking for someone to create this particular thing that I can purchase. But they also face their own challenges with that. I mean, career is part of who you are. It's a passion. It should be a passion. It's something you want to do, not just to make an income. But they do. I mean, that's the kind of the affirmation of creating art, is that, you know, that they can sell that piece to someone and make an income. And many times, going back to that conversation about parents and Social Security and waivers, many times the parents will just say not for sale because they don't even want to go down that road of how they're getting that income. If it's cash, fine. If it's a check, that's problematic. And there are artists who just don't participate in the program or participate very seldomly because of that piece of it. And producing art and selling art is one step to having an occupation in the creative careers. That's not the only thing. You can go into many different many segments within creative careers, behind the scenes of theater art or producing music. But that's your first step, is creating fine art, going into those next steps. But if they're stopped then into getting an income, then they're not going to pursue it further. And that's the piece that the Kennedy Center and I have been really grappling with, is that they're stopped because they can't, the employment, the pay, there's a stopping point with the income there. And there are artists that they need some income to pay for the paper and the pencils and the paint and the canvas to move forward, and they don't have that. So there's that piece of the employment in the creative sector that I struggle with.
Yeah, the point, and it was mentioned in various ways, earlier today, but the fact that job should be a career or passion, not just income, I think that's kind of the breaking point. I think we have been talking a lot about, over the years, of getting people employed, getting a paycheck so that they can make choices and participate in the community. But I think the career and the passion for work and being able to earn money through what people love. I think that's the next step for people with disabilities. I don't think we are there yet.
I agree.
There are exceptions, of course. Yeah. So it's 10 minutes to our first presentation of the evening. I want to give everybody time to take a bathroom break. So we will be back in 10 minutes for Japan, Malaysia, and Australia.